Hello and welcome to Joint Camp, our pre-surgical orientation for your upcoming knee or hip replacement. This class outlines the entire surgical process from preparation to recovery following your procedure. Riverview Regional Medical Center has partnered with your orthopedic surgeon to provide the education and care that you need for a successful joint replacement. Riverview has proudly served Etowah County and surrounding areas since 1917. My name is Stacy Bertram. I'm your orthopedic nurse navigator. My role is to guide you through your joint replacement journey and make sure you have everything you need throughout the process. Please feel free to contact me with any questions you have regarding the information presented. I am happy to help you on this journey. You'll see my phone number and email address below. Either way is a good way to contact me. The first step of this journey at Riverview is your appointment for pre-admission testing. This is a very important appointment to ensure a safe surgery. If you have not already been to your pre-admission testing appointment, you will come to the outpatient admitting entrance that is on the 3rd Street, and that is right past the emergency room entrance. Come through the outpatient admitting door and you will check in with your ID. Once you are registered with them, you will go to the 2nd floor day surgery area for the rest of your appointment. Labs will be drawn, urine will be collected, and an EKG will be done. You will answer questions to complete a medical history and a review of all of your current medications that you take. Please bring all medications with you in their original bottles. You will be giving detailed pre-surgery instructions. Please note that if you have cardiac conditions or you are on an anticoagulant, you may need additional cardiac clearance before your surgery. You are the key player in ensuring a successful recovery from your joint replacement. Our goal is to involve you in every part of the process, including hearing from you before and after surgery. The Center for Medicare and Medicaid Services require a pre- and post-surgical assessment that is reported by you, the patient. Before your surgery, we will get your response on questions involving your pain, mobility issues, as well as health literacy and some mental health questions. This survey takes about 10 minutes to complete. After you are fully recovered, we will reach out to you to answer similar questions to measure your improvement and functional status. This doesn't take place until a year after surgery, but we wanted to let you know that we will be reaching back out to you via mail or an app called MyChart to get your post-surgical responses reported. If you do not have MyChart, this is an app that you can get on your mobile device, and it can be very helpful to you. It gives you access to portions of your electronic medical record, like your lab results, x-rays, medications, immunizations, and visit summary information. Please ask us for help while you're here to get this app downloaded so you can stay informed about your medical care. If you have this app, it will send you the survey to complete electronically. To prepare for surgery, we will start by getting your home prepared. Look around your home for any narrow walkways and move furniture as needed for you to navigate through with a walker. A common problem spot is the bathroom, where we often have additional storage shelves that may need to be removed temporarily. Tripping hazards need to be removed as well, such as bathroom or household rugs. Pets are also a tripping hazard, so please don't let them make you fall. You will need someone as a helper or coach to help with meals for about 24 to 48 hours after surgery, as well as drive you to therapy appointments. Smoking increases your risk of lung complications during and after surgery, and decreases healing during recovery. So you want to quit or cut down on smoking. Alcohol should be stopped or limited 2 weeks prior to surgery and not resumed until cleared by your surgeon. Do not mix alcohol with narcotic pain medicine. It will make your recovery easier if you do these exercises listed consistently leading up to surgery. Leg extensions, leg raises, and knee bends should be done as much as you can tolerate. These exercises will strengthen and stretch your leg muscles. Most patients stay 1 night following the procedure, sometimes 2. Please pack comfortable, loose-fitting clothing that has room for swelling. Your whole surgical leg down to your foot will be swollen. Bring non-slip shoes that also have stretch in them to allow for swelling. Please bring a copy of your advance directive, if you have one, for us to keep on your record. Bring your CPAP machine if you use one. And please bring any needed home medications. You will be told at your pre-admission testing appointment the medications that our pharmacy does not have. Please do not forget these, and when you get here, turn them into your nurse. Please keep in mind that we need to administer all of your medications while you are in the hospital. So if you had an emergency, we know what is in your system. Please do not take any of your home medications that our nurse did not administer. Now that we have your home prepared, we will take a look at the days leading up to surgery. 10 to 14 days prior to surgery, you need to stop taking medications as instructed by your physician and by the nurse at your pre-admission testing appointment. Please stop or cut back on alcohol intake and smoking. 3 nights before surgery, you're going to start skin preparation with the antibacterial soap that you received at your pre-admission testing appointment. The day before surgery, you will receive a phone call with your arrival time and a reminder to bring any home medications that we do not carry. The night before surgery, please shower, wash hair, and bathe as instructed with the antibacterial soap. Please remove any nail polish from your fingernails. Painted toenails are fine. The night before surgery, after that shower, don't use any lotions or powders. Make sure you're sleeping in clean pajamas on clean sheets. And do not eat or drink anything past midnight. Now moving to the day of surgery, it's finally here. Make sure you take only the meds that they instructed you to take in your pre-admission testing appointment with a small sip of water, just enough to take the medication. Do not shave or use tobacco products the day of. Do not wear makeup or jewelry. Make sure you arrive at the hospital on time. You want to park in the main parking lot, come in at the main entrance, and you'll check in with your ID with security. Then you will go to the second floor day surgery area, and they will place you in a hospital room where you'll wait to go to the OR. If you have someone with you, a visitor can stay with you until they take you to the OR. We have asked that there only be a maximum of 2 people. Now, while you are there waiting to go to the OR, the anesthesiologist and surgeon will come to your room and do last-minute history checks and questions. An IV will be inserted. They will check your vital signs. Pre-op antibiotics will be administered. You'll get fluids for hydration, and they'll do a nasal swab checking for MRSA. Once all that is complete, they will come to take you to the OR, and your visitor may wait in the same rooms. They can stay there, or they can go out to a surgery waiting area around the corner. When the procedure is finished, the surgeon will call that visitor or family member to let them know that it's complete. After surgery, the patient will wake up in our post-anesthesia care unit and will be monitored there for 1 to 2 hours. The patient will then be brought to their hospital room on the 7th floor orthopedic unit. This is the first time visitors will see the patient after surgery. The patient may eat and drink right away as long as they are awake and alert. Right away, your nurse starts working towards keeping your pain under control. Your nurse will also perform a neurovascular assessment to ensure everything is intact after surgery. The nurse will feel the pulse on each foot and check your level of sensation and foot movements every 4 hours or so. It is important to let your nurse know if you have any pre-existing neuropathy or foot drop. The first goal for the patient after surgery is to make sure your bladder wakes up properly and you are able to void or urinate. Your nurse monitors your elimination closely and records any output, so please do not flush anything until we have seen it. After you void, we will scan your bladder with an ultrasound machine to monitor for post-anesthesia urinary retention. Most patients are surprised to find out that we get you out of bed and walk the same day of surgery. We will assist you to walk to the restroom, and physical therapy will work with you as well. The earlier that you are mobile, the better outcome you have. There is a lot of equipment that we help you manage the first day of surgery. The patient is connected to a vital sign machine, has cords connected to each leg that's called a sequential compression device. We'll talk more about that in a minute, as well as an IV line, etc. All that's connected to the patient. So please do not attempt to get up without assistance the first day or night of surgery. Just use your call light and let us know that you need help so we can unhook and rehook everything back up properly. Let us help you because it's a lot to manage. The next day, most of these items are removed and the family or visitor will be able to help the patient more at that time. For your overnight stay, you are allowed one person to stay with you, but it is not required. Let's take a closer look at some of the equipment that you're going to see. The patient comes up from surgery with this machine, and it does two different things. This patient had a shoulder replacement, and this is the cold pack on her shoulder. If you had a knee replacement, this cold pack, of course, will be on your knee, and hips will be wrapped around your waist on the side that you had surgery. The reservoir holds water and ice and pumps the cold water up the thick black line to the cold pack. The cold therapy decreases swelling and pain postoperatively. This machine will go home with you, and a lot of patients ask me how and when to use the cold therapy. So please know that you can use it as often as you would like to. There's only one time that you should not use this machine, and that is before you go to any physical therapy appointments. The reason for this is your therapy will be much more difficult if your joint is cold and stiff. The other function of this machine is a sequential compression device that squeezes your calves to help blood circulation while you are in the bed. This is the black wrap on each leg. This is important to have on because it reduces the risk of blood clots. This should be worn the day and night of surgery. The next day, we expect that you are up out of the bed, moving every hour, and your movement will take the place of the SCD leg pumps to help your circulation, so you won't have to wear those any longer. This machine often gets left in the room, so please try to remember to take it home with you. It is your machine, so it has lots of parts. Make sure everything's gathered. We try to help you with that, but I like to educate everyone to make sure you have all that you need when you go home. The next piece of equipment is a rolling walker. Please note the two wheels on the front, and it is stationary on the back. You will use a rolling walker for the next 2 weeks. This is to help keep you steady and to improve your mobility while you are adjusting to your knee or hip replacement. If you do not already have one at home, we give you a prescription at discharge that you will stop by any medical equipment supply place to pick up on your way home from the hospital. We do have rolling walkers for you to use while you are here at the hospital. An incentive spirometer. This is very, very important in preventing pneumonia. You are at risk of developing pneumonia because you are placed on a ventilator during surgery that blows air down into your lungs. This also forces any drainage that you have down to the bottom of your lungs. If the drainage stays there, it can set up infection and you develop pneumonia. We have to get things moving by coughing and deep breathing. This incentive spirometer prevents pneumonia because if you do it correctly, it makes you breathe deeply and cough. You do not want to combine pneumonia with joint replacement recovery. That would not be fun. So this should be done 10 times every hour that you are awake, all the way out to your 2-week follow-up appointment. So make sure you take it home with you from the hospital. I suggest breaking it up to 5 times every 30 minutes because it can make you dizzy pulling in that much air all back to back 10 times. We need a long inhale on this, keeping this indicator. Let me show you with my laser. Over here it tells you keep indicator between these 2 arrows. When you put your mouth on this and you inhale like a big milkshake, this indicator is going to come up. If it shoots way up here, that means you're doing it too strong and you won't be able to pull in as much air that way. We'll teach you more about it while you're here. Next up is a Hemovac drain. This may be a place to drain any fluid that may accumulate in your joint during surgery. Not every patient comes out from surgery with one. And just know that if one is placed, it is only there one night and it is removed the next morning. You will have one of 2 surgical dressings. Both of these are applied in a sterile environment in the OR. You will have a bandage like this one. This is called an Aquacel. It is impregnated with silver and it is an antimicrobial dressing. Or you will come out with a transparent tape looking like dressing. It's called Prineo Dermabond over your incision site. Both of these types of dressings can stay in place up to 2 weeks until your follow-up appointment if they remain clean. A small amount of drainage up the middle is normal with this first dressing, the Aquacel bandage. If the drainage amount is enough to fill a section from side to side, such as this picture, it is time to change the dressing. Actually, this one is probably past time because it's bulging a little bit. We do send you home with dressing change instructions and 1 extra dressing. The other time the dressing needs to be changed is if it begins to peel off at the edges, threatening to expose your incision. This happens with hip replacements because of waistbands being pulled up and down over it frequently. So make sure you ask your helper or coach to keep an eye on that dressing and make sure the edges are all flat. Total knee arthroplasty. So following this procedure, you will no longer have arthritis in your joint. The picture on the left is an arthritic knee where the cartilage has been eaten through. You may have bone rubbing on bone. There is inflammation causing chronic pain. The damaged cartilage is removed and replaced with a shiny new femoral component and a tibial component. A plastic spacer is placed between the 2 parts. Knee replacements only require a couple of precautions. Rule number 1, make sure you move often to prevent stiffness. When you're resting, The two positions that you want your knee in is either fully straight, so when you're laying in bed or you have your feet propped up or in a recliner propped up, your legs should be fully straight. The other position that is acceptable is the leg fully, or that knee being fully bent with your foot pulled back as far as you can. Your knee should not stay in the halfway position where it's neither straight nor bent. I will tell you that this is where it does not hurt as bad, but if you leave it there, scar tissue will wrap up that joint and you will not be able to straighten or bend your leg if you leave it in that halfway position for a long period of time. If scar tissue binds up the joint, treatment for that is going back to surgery to tear through the scar tissue so you can regain your range of motion again. So that leads us to rule number 2. No pillows or blankets should be placed under your knee. The reason for that, it places your leg in that halfway spot. Please also, if the CPM machine is ordered for you, make sure you use that as prescribed. Stiffness is your enemy with knee replacement recovery. We will cover pain management in detail in a few moments. Along with pain medicine, you may request a muscle relaxer from your nurse that may help with some of the discomfort from surgery. If you are a knee replacement of Dr. Sparks, he orders a continuous passive motion machine for you to use daily for 3 hours. His office sets up delivery of this machine to your house. This typically arrives the day before your surgery. This machine is a tool to passively provide range of motion that helps prevent the stiffness. Our physical therapy will place you on this while you are in the hospital for the full 3 hours. Once you are home, you may divide the 3 hours up any way that is best for you. You will increase the degree of bend by 5 degrees every day until you reach your goal of 120 degrees. You will do this for 2 weeks, then they will come pick it up from your home. For our total hip arthroplasty patients, the picture on the left shows the angry, inflamed, arthritic hip joint that is probably causing you a lot of pain. On the right is what your new hip will look like with the arthritis removed. A new ball and socket is placed with the stem going down into the femur. There are a few precautions or rules to follow just for the first 2 weeks after surgery. Rule number 1, do not cross your operated leg over the other leg. If you sleep on your side, please place a pillow between your legs to prevent your legs from crossing. Do not bend over at the waist to pick items up off the floor. Do not turn your foot in on your surgical leg. This causes a twisting motion at the joint. Please be careful not to sit with your knees higher than your waist. Make sure you keep them low. And just like knee replacements, please move often to prevent stiffness. In addition to physical therapy, an occupational therapist will see hip replacements in the hospital to bring you a hip kit. This kit contains items that will help you maintain your hip precautions. You will be taught how to use a sock aid tool to put your socks on without bending over. You will be given a long-handled shoe horn to help you get your shoes on. You will be given a long-handled grabber for picking up items off the floor without bending over. And you will be given a long-handled shower sponge to help wash your feet in the shower without bending over. Physical therapy is crucial, very, very important to a successful joint replacement. Therapy starts the day of surgery. The earlier that you mobilize that joint, the better outcome you will have. Therapy goals are to ambulate or to walk with a fluid, natural motion. The post-op pain tempts patients to hobble on their leg and not put full weight, but our therapist will remind you to walk heel to toe to work towards a fluid, natural motion again. Be sure that you are taking your pain medicine to allow you to work that joint as you need to. Physical therapy will also work with you to build strength and mobility, remind you of the hip precautions, work with knee replacements on their range of motion, and take you on and off the CPM machine if one is ordered for you. You will walk to our physical therapy gym up the hall and practice climbing a few stairs before you leave. They will teach you to go upstairs, leading with your air quote good leg, which is your non-surgical leg. Then you will turn around and go down the stairs, leading with your air quote again bad leg, which is your surgical leg. While your surgical leg is actually the better leg now, we call it the bad leg because of the post-op pain, and please keep in mind that that does improve over time. Our case manager will make sure you are set up with physical therapy before you leave the hospital, and you will complete about 6 to 8 weeks of therapy depending on your progress. So your typical post-op day 1, you've had your knee replacement or hip replacement surgery, you've slept all night, hopefully, and now it's the next day and we want to get you up and get moving. Your surgeon has ordered that our night shift staff wake you up between 5:30 and 6 a.m., help you out of the bed up to the chair. Now when we do this, please go ahead and request some pain medication, as you will be stiff from sleeping, not moving around much throughout the night. And we want to go ahead and get the pain medicine in your system and working, so when therapy comes later, you will be ready to work with them. Breakfast will come around 7:30ish. Your surgeon will come at some point that morning and check in with you, see how you're doing. Physical therapy will come. The first time they will leave you some exercises to do to warm up that joint. Then they will come back and they're going to take you to the stairs and work with you on those. And then discharge typically happens around noon. If all is well, nothing else to do, then you are usually let go by noon. So your surgeon does request that we get the mindset of recuperating in bed completely out of your mind, both while you're in the hospital and when you go home. We want you out of the bed for all meals. I'm telling you that movement and you keeping moving, keeping active is what's going to be critical for you to have a good recovery. Make sure you do all exercises as instructed between sessions with physical therapy, and increase your activity as you get stronger. All right, so we're going to take a look at post-op medications that you will be started on. One of them is called a blood thinner. This reduces the risk of blood clots, as knee surgeries, knee replacements, hip replacements do put you at a greater risk to develop a blood clot. Your doctor will start you on a blood thinner within 24 hours of surgery, and it is very important that you are given a prescription to take at home. Knees will take a blood thinner for 14 days after surgery. Hip replacements take a blood thinner for 30 days after surgery. While you're on this blood thinner, please watch for any signs of excessive bleeding and notify your surgeon if you notice that, and he can change that blood thinner to a different kind or give you instructions. Also, do not take any NSAIDs like ibuprofen while on the blood thinner, as that can thin your blood even more and be dangerous. let's talk about your bowel regimen. So narcotics, anesthesia, decreased mobility, decreased intake, all of that slow down your GI tract. So while you're in the hospital, you are started on stool softeners and laxatives to avoid constipation. With that said, you're only here one night, possibly two at most usually. So when you go home, you want to continue to take over-the-counter laxatives until you have a bowel movement. Most of the time your doctor sends a prescription for the stool softener, Colace, to continue that. But whatever works for you as far as a laxative, you can go ahead and get beforehand so you have that ready when you come home. Pain medicine. So your doctor does order pain medicine for the hospital, and you will be sent a prescription for pain medicine once you go home. Please keep in mind when you're in the hospital, the pain medicine is ordered as needed, which just means that you need to communicate with your nurse. Please let them know. You will be asked very frequently by the nursing staff, physical therapy, what would you rate your pain? And we will discuss that in a little bit more on the next slide. But the main thing I want to make sure you understand is to don't lay there and hurt. You can use your call light, and you can always ask. Even if we just gave you something 30 minutes ago, typically depending on your blood pressure, we can give you something else if that didn't work. So just communicate with us, as your nurse could get stuck next door in a code situation. We don't want you to wait on her to come in and ask. Use your call light, and someone else can bring it to you if your nurse is tied up. Please be aware that pain medicine can cause constipation. And once you arrive to the floor, we don't give IV pain medication. You do receive that in PACU immediately after surgery. But once you come up, we typically only do by mouth pain medicine. And that medicine lasts longer, and it gives us a chance to test out what you're going to go home on and make sure it works well for you. Please keep in mind that if your blood pressure starts to get low after surgery, that can limit the pain medicine that we can give you. This is out of your control, our control, but I just like to let everybody know that ahead of time, because pain medicine can lower your blood pressure even more. So we don't want it to become a dangerous situation. We'd rather manage your blood pressure, and you might hurt a little bit until we can get that up. Dealing with pain, other than medicine, there are alternative methods to help control it, and that is that ice machine that I showed you earlier. Keeping the ice on it will help decrease pain and swelling. Elevating that extremity can help with the pain. Just changing position will help. Also, mobility. Keeping in mind working out any stiffness that may have set in. Once you get it moving a few times around, like on the CPM machine, those first 3 or 5 times around, it can be painful. After that, that stiffness is worked out, and it gets a lot more loose, and it's a lot more comfortable. So working out stiffness will help manage your pain as well. So we're all speaking the same language regarding pain. We do ask you to rate your pain on a scale of 0 to 10. This is kind of what we have in mind. So if you say 0 out of 10, you are experiencing no pain whatsoever. A pain score of 1, 2, or 3 we consider mild. This is pain that doesn't interfere with your regular activities. You may barely notice the pain. You can talk, you can communicate, you can do any kind of function. Just feel kind of twinges of pain here and there in the background. Once you reach 4, 5, or 6 as moderate pain, this pain starts to interfere with your regular activities. You can still ignore the pain at times, but a lot less frequently. It's making it more difficult to concentrate. You could still work through some activities, but it's coming on strong. And I would recommend not letting it get past this point before you ask for some pain medicine. go ahead and ask so we can try to prevent it from going higher. If you reach a 7, 8, or 9, this is severe pain. This pain keeps you from doing your regular activities. You really can't talk, carry on a conversation. You won't be able to sleep well. It's pretty intense pain. You're probably crying at this point. It is distracting, and you don't want to work with therapy. It's just very difficult to manage at this point. And of course, 10 is the worst pain that you can ever imagine. And if you let it get this high, it is difficult to bring down, although not impossible. We'll just have to stay on top of it. So just communicate with your nurse and keep this pain scale in mind. So you have made it home, you've discharged. Let's look at what your surgery recovery would look like moving forward. When you leave on your discharge paperwork, we will give you an appointment to follow up with your surgeon in 2 weeks. You won't be able to drive until cleared by your doctor. Typically that conversation happens at your 2-week follow-up, and it depends on how much pain medicine that you're still requiring. While you're at home, you want to get up every hour and walk, being careful to avoid any tripping hazards. Watch out for pets. Again, hopefully those rugs are picked up. So getting up, as you're going to see soon, prevents a lot of possible complications that can happen. So movement is key. After you've had a knee or hip replacement, from here on out, you're going to need prophylactic antibiotics before any invasive procedures, such as a dental cleaning, any other surgeries. This helps prevent infection. The reason this is so important is that if you were to get infected or exposed to bacteria, it has an affinity for your joint replacement. So it will go to those fake parts, set up camp, and then your replacement will get infected. And that leads to a road of more surgeries, taking it out, putting a new one back in once the infection is cleared. Long story short, please ask your dentist office or whoever's doing the next procedure, let them know you've had a replacement and you need those prophylactic, or if you can't remember that word, just say preventative antibiotics. And dental offices, other physicians are very familiar with this process and will call you in something before your procedure. Please avoid getting sick from now on. Remember, hand washing is the #1 way to prevent infection. 20 seconds with warm soapy water will save you from getting a lot of stuff going around. Please always continue your physical therapy until they discharge you from that, and your exercises at home. Remember, movement is key, and typically physical therapy lasts from 6 to 8 weeks, again dependent on your individual progress. Don't forget the survey that will either come to your mail or an alert will be sent through MyChart app to complete and allow you to report your own outcomes to see how much you've improved after your joint replacement. Right, in this section we will discuss possible complications, and please note that these are preventable complications, and remember that you are the key player in all of this, helping us make sure we avoid these things from happening. So to prevent infection, make sure the incision is covered with a dressing until removed by your doctor's office. If you do have to change your dressing at home, follow the instructions that we give you in your discharge paperwork, which are to wash your hands before changing the dressing. Do not touch the incision, don't cough on it, don't breathe on it, get it covered up right away. And do not sleep with animals until your incision is fully healed. How do you know if you have infection? So the first 2 weeks, your incision is covered up with that dressing. Once that dressing is removed, from then on you will be able to notice the incisional site. If you notice increased redness, swelling, a foul odor, or fever over 101 degrees, you need to notify your surgeon of any of these signs, so he can handle that by calling in a prescription more than likely. Please note the fever over 101. If it's less than 101, it could just be your lungs, and we'll talk about preventing pneumonia in a few moments and what to do about that. Constipation prevention. So take over-the-counter laxatives or whatever works for you to help have that bowel movement. Increase your water intake while you're on this pain medicine, and make sure you keep moving. That's going to help your bowels move and process things. Notify your doctor if you haven't had a bowel movement after 3 days of surgery, 3 days after surgery. Blood clots. So to prevent blood clots, we are walking, we are doing ankle pump exercises, which is simply when you're sitting in a chair, maybe you have your legs propped up, just moving your ankle or your toes all the way back towards your leg and all the way down, up, down, and to keep moving, getting up and walking every hour. Taking that blood thinner as prescribed also is going to help prevent any blood clots. How do you know if you have a blood clot? You may notice swelling in your leg that doesn't go down when elevated. It would be a warm, very painful, tender spot that could be either in your calf muscle, the back of your knee, or your groin. And it doesn't have to be just the surgical leg. It could be either leg. So if you notice when you back up to a chair with your walker, you bump the back of your leg and it's very tender, ask someone to look at it and make sure it's not red, warm, those kind of things. If you do notice that, please notify your surgeon and do not walk on that leg. Symptom of a blood clot in the lung. This is something that you would just call 911. Whoever's with you will notice that something is very bad wrong, and they won't have to question. You will have sudden chest pain, difficulty breathing, sweating, confusion. This could be a blood clot in the lung. So with all that said, make sure you're doing all the things to prevent by keeping moving and taking your blood thinner as prescribed. Just a couple more preventable complications is pneumonia. So to prevent pneumonia, if you remember that breathing exercise picture I showed you called the incentive spirometer, make sure you're coughing and deep breathing on your own to get that sinus drainage moving and not just sedentary in your lungs. Walking also helps prevent pneumonia because it changes the way you breathe. You have to breathe a little deeper. So notice that yet again, moving is key to prevent some complications. Signs of pneumonia: productive cough, a fever over 101, chills, difficulty breathing. Please notify your surgeon if you experience any signs of pneumonia. Also, if your fever is not quite 101 but it's higher than normal, do extra breathing exercises on your incentive spirometer, and that might help because you could be on your way to pneumonia, but you could still prevent it. So make sure you do that 10 times every hour that you're awake until your 2-week follow-up appointment. If you are a hip replacement, we discussed earlier the hip precautions. So a possible complication is you could dislocate your hip if you bend over at the waist and pick up something off the floor, or if you cross your legs. So how you know if you've dislocated it is you'll experience severe pain, rotation or shortening of the leg, and you are unable to walk or move that leg. So again, just for the first couple of weeks, try not to do those specific movements. In review, I'm going to wrap it up and give you a to-do list and a don't list. So make sure you take ownership of your recovery. You're the only one that can force yourself to get that knee moving, even though it hurts a little bit those first 2 weeks. You have to take control and keep it moving. Make sure you keep good hygiene, good hand washing, clean sheets to avoid infections. Make sure you take care of your body while it heals. Make sure your diet is good, you're drinking enough liquids, especially water, again to avoid constipation. Report any signs of infection or complications to your surgeon first. We do not recommend going to the ER first unless it is a life-threatening emergency. Make sure you bring home your CPAP, bring your home CPAP to the hospital and use your own while you're here. You can go ahead and locate a convenient medical equipment company for you to pick up your walker on your way home. It just kind of helps you to know where you're going to go. And do keep moving. I can't stress that enough. There's one thing you remember from this presentation is movement is key. A few things we don't want you to do is, the first is fall. Please make sure your home is prepared. Make sure you've picked up rugs. You make plans for your animals or keep them away from your feet, and you do not fall, which could land you right back in the operating room. Please don't disregard the knee or hip precautions. Please follow those as best as you can so you have the best outcome. Please don't stop taking that blood thinner until instructed to do so we know you are in the clear. Please don't sleep with animals until your wound is healed to prevent infection. I mentioned this earlier. Don't go to the ER unless it is life-threatening. The reason for that is there are a lot of germs in the ER that we would like to keep you away from if it's something that can be managed over the phone. Your surgeon is the best place to stop. Now, if you cannot breathe or your heart is having issues, we can worry about germs later. So by all means, come to the ER if it is life-threatening. Please don't bring valuables to the hospital. Please keep in mind that cell phones are troublesome as they get lost a lot at the hospital. So if you do bring it, please make sure you're aware of where you lay it down. Don't lay your cell phone on the dietary tray, because the dietary tray is going to be picked up and taken downstairs and that phone is gone. Also, if it's left in the bed with you, while you're in the restroom, we could be coming in and changing your bed sheets, and your cell phone is down the laundry chute, never to be seen again. Riverview cannot replace those items, so just be careful. Bring only what you have to have. Last but not least, do not get discouraged. This is a journey, but it is a short one, and about 2 weeks after post-operatively, while you're still doing therapy, your life is going to look a whole lot different, and you're going to be very happy that you have a new joint to live with. You do have some contacts and resource phone numbers here. You probably already have your doctor office numbers, but below that we do have some hospital numbers that you probably do not have. Riverview Regional main number is there. The floor that you will be spending the night on is called the orthopedic floor. It is on floor 7, and that is our nurse's station number. Again, my name is Stacy Bertram. I'm your orthopedic nurse navigator. You can call me at that number with any questions that you have from this presentation, or you can send an email, and I'll be happy to assist you. The number for second floor surgery pre-admission testing is also listed here. That number is helpful if you develop a fever before surgery, or if that morning your car won't start, something happens. That's where you will report to the day of surgery, and you can call that number and let them know what's going on. And that wraps it up, folks. We want to thank you for choosing Riverview Regional Medical Center. We look forward to exceeding your expectations and providing you the highest quality care. Thank you so much, and we will see you soon.